Hello, everyone, and welcome to our Lunch and Learn series, Speech Language Development and Disorders, the Parent's Guide. We will be discussing what is an SLP and speech therapy today. We wanted to bring the series so that parents could have some information. We are located in Locust Grove, Georgia, and we know in our area there is a shortage of speech therapists, and the need for speech therapy is high. And so there are parents and patients on wait lists for 6 to 8 months. And so we wanted to give parents an opportunity to get some information and strategies to help while they're on wait lists, or even if your child is in need of speech therapy. There'll be strategies and information on how to expand language, to facilitate language at home without flashcards or any gadgets, just what you have at home, and how to communicate and bombard your child with language so that they continue to progress and make growth and meet those milestones. So we will begin. What is an SLP in speech therapy? Before we start, we'll do some housekeeping. We'll discuss what shout speech and language therapy is and where we are. What is an SLP and what is speech therapy? Some quick housekeeping before we begin. The information provided here is of a general nature and should not be used for diagnostic purposes or considered a form of treatment. For any concerns, we strongly advise you to consult with your pediatrician or your local speech language pathologist. It is crucial to remember that every child is unique, and evaluations and therapy plans should be tailored to their individual needs. The information we provide at Shout SLT is intended to empower parents with knowledge and support when there is need. I also want to add that make sure that where you are, you seek the information from professionals, your pediatrician, your schools, teachers. Every county, district, state, local area has their own procedures and process for receiving services and private practices as well. So you will have to find out what is valid for your area. This is general information that you'll be able to take to help guide you to through that process. In this session today, you will learn how to connect with Shout Speech and Language Therapy, what a speech language pathologist is and their role, what to look for when seeking an SLP, and what speech language therapy is and its purpose. We encourage you to connect with us so that you know when we're posting these videos and when we have our lives and other information that we post on our social media. You can follow us and like us on Facebook and YouTube at Shout SL Therapy, on Instagram at shout.sltherapy, and our website www.shoutsltherapy.com. So, what is Shout SLT, or Shout Speech and Language Therapy? Shout Speech and Language Therapy is a private practice in Locust Grove, Georgia. I am Shirley Jackson. I'm the speech language pathologist and the owner of Shout Speech and Language Therapy, and I provide the services to our patients. Uh, Why Shout? We serve the family, not just the child. We provide our patients and their families or parents, caretakers, with other services that may benefit them. We connect them with local the schools, preschools. We help find the best setting for our children. We connect with other therapists and other providers if our patients need. And so we don't just see our patients solely. We see we help and see the family with other needs that they may have regarding communication and services. Our purpose is and our goal is to serve as many families as possible, and that's one reason why we're doing this Lunch and Learn series, to be able to reach out to parents who aren't our patients and provide this information to help them with this process and with increasing language needs, strengths, and meeting milestones where they need it. And also, shout. What's the name? Shout. Shouting communicates so many emotions: fear, joy, frustration, sadness. These are so many emotions our families and patients experience. We also shout for action, to demand, to cheer, and request. So here at Shout, we encourage shouts of joy for the smallest progress, for hope, for faith that our families will leave us learning something new that will impact them for years to come. We believe that He will yet fill your mouth with laughter and your lips with shouts of joy. A lot of times when we know that our child may need services, it's difficult. And at Shout, we try to be empathetic. And as a parent of three children who also have needs in various areas. I do understand the frustration and difficulties in having to learn and start a new chapter on working with your child and providers to provide something that you cannot. And so we take that into consideration with our patients and when interacting with our patients and their families. So let's begin. What is an SLP? An SLP or speech language pathologist. Also, you hear it's referred to as SLP, speech therapist, speech teacher, speech pathologist. They're all the same person. What is an SLP? We'll look into their qualifications, education and licensure, their scope, what it is that they do, where you will find them, the settings and different specialty areas, and what you could look for when you're looking for a speech language pathologist or SLP. And so the qualifications to be an SLP, the education, you have bachelor's degree and master's degree. Master's degree is the level that you're able to be certified and licensed to work independently. A bachelor's degree, what we call our SLPA, speech language pathologist assistant, and they will have to work supervised under a licensed speech language pathologist. And so once you get your bachelor's and your master's degree, then you have clinical hours that you're doing while getting those, and internship. And then you go into a clinical fellowship year. That means you're pretty much done with, you've graduated, you have your clinical hours, and you are working, you're fully employed, but you are under supervision of a licensed therapist. And once you finish that year, then you are independent and do not need the supervision. And you have to also pass a national exam, the praxis, which covers broad areas of speech and language pathology and communication disorders. So you'll have your certification, which is our national association, and that's where you get your C's, your certified clinical competence. And licensure is your state license. You do not need your C's or the National Association certification to practice, but you do need a license, your state license to practice. And you may have one license in one state, it does not automatically transfer to another state. And all states have their own regulations and requirements. And so therapists would have to be licensed in multiple states if they're working in multiple states. Employment, therapists can be employed in various areas, schools, hospitals, outpatient centers, nursing homes, private practices, and a lot of other areas. And so once you're licensed, you choose where it is that you want to be employed and what area you want to concentrate on. Uh, I primarily practice with pediatric patients, children, and so there are people who only practice with adults. So the therapist will, that's their own professional preference. Maintenance and requirements. So once you have your license, your certifications, you have to maintain those. And the requirements, they all require continuing education. When you have to renew, they ask about any legal issues you may have. For the association, National Association, you have to have an ethics course. And if you plan on supervising, a supervision course, supervising students or other therapists, supervision course. And so, what are my qualifications? Like I said, I'm Shirley Jackson. I earned my bachelor's and my master's degree in speech pathology and audiology from Florida State University. I also earned a specialist degree in special education from the University of West Georgia. I've practiced in Florida, North Carolina, Louisiana, and Georgia. We aren't military. My husband coached college ball, so we moved often. We are pretty much put here in Georgia for now. I've served in nonprofit organizations, outpatient rehab centers. I served in schools and, of course, for private practice. I have over 23 years of service in practicing, 20 years in the schools, and sometimes simultaneously in the schools and doing outpatient rehab. I've served over 1,000 students and families. I've evaluated and sat in IEP meetings over 23 years, sometimes with a caseload of 50, 60 students. So I have had my share of IEP meetings and parent communication and treating children for various disorders. I've also was teacher of the year in Okeechobee, Florida, where we were living, and I also supervised students. I've supervised interns and clinical fellows and therapists during my employment in my experience years. I now have private practice. I no longer am working in the schools. Shop has been open for about 4 years. I did it part time while still in schools, and now I'm full time private practitioner here in Locust Grove, Georgia. Uh, my practice concentrates on primarily pediatric early language development and articulation phonological disorders. So I see kids. Most of my patients are between 1 and second grade age. And so once they get older, I usually uh, follow up or refer them to another therapist because that's more academic based. And I do more of the play therapy on the floor and early language development. And so I like to concentrate on those areas and target my practice in those areas. I do see older kids with articulation phonological disorder because that is one of my passions with working on um, getting kids to be intelligible when they're communicating. The scope of practice, the speech scope of practice, and what do they do? We assess and we diagnose, which means we test and we say this is the delay or disorder that the child may have. Various disorders, including articulation, speech, language, swallowing, feeding, fluency, which is stuttering, and voice disorders. We do formal assessments, we do dynamic assessments. It's not taking plus or minus, but we're really seeing what the kids could do and not comparing them to their peers in a large study. We plan and treat, we set the goals, we monitor progress, we analyze, we use our strategies and our evidence to determine what is needed, what's the next step to come. We collaborate with parents and other providers to determine what is best for the child, what they need. And when you're working with a team, you can see a lot more progress because everyone's addressing the same needs. We also educate and counsel patients and caretakers and community. We definitely like to let people know what it is that we do about language development. We definitely counsel parents because sometimes we see them, meet them at the vulnerable times. A lot of times we are the first people to tell parents that there is a delay or there is a need or to seek more from another provider. And so we do like to be empathetic and caring and understand that this could be difficult for many parents. So the therapist has many roles in this process with treating patients. So when contacting an SLP, you can consult with your pediatrician first, especially if it's private practice. They will need medical reason for insurance to cover the services. So you consult with your pediatrician, determine if the child is meeting their milestone needs. There are pediatricians who say wait, but also tell parents, go with your feeling. If you feel that you need to get more information, there's no harm in getting more information on determining whether your child does have a delay or they do not. So you'll get the referral. A lot of private practice therapists will request those referrals if your pediatrician hasn't given you one or you don't have one. So that's not a deal breaker if you don't have one. Search for your local providers. You could do a Google search and find local providers in your area and read the reviews. Ask family, ask friends, ask your school district if they know of any local providers. A lot of times we know one another, and so someone can make a referral for you to you that will best fit your child's needs. Call and ask questions, share your concerns, tell them what you're looking for, and see if they can help you. And see how you feel about the initial contact when you speak with them. If you feel that, yes, they have given you the information you need, and you feel comfortable about dealing with this person and having them deal with your child. And in our area, since we have wait lists, I do tell my patients to get on multiple wait lists because you never know when one's going to open up. Practices hire new therapists, patients exit, patients leave, patients move. So it does come up. And so if you're on one wait list and you're waiting, You could have started sessions with someone else and started receiving services while you're still waiting. I have some parents who say, no, no, we'll just go with you because we want to go with you, and so they will wait for services with a particular speech therapist. But a lot of parents just want to start services and get help for their children, so they will they don't mind going to other therapists, and I encourage that because I want parents to get the services as quickly as they can. And then always call back once you get on a wait list. Sometimes things move quickly, sometimes they move slowly, and sometimes uh, therapists and centers, they do get you down on a wait list, and then they haven't called back. So I encourage parents to call back if you've been on for a month. Call and say, hey, is there any changes and any move, and expect anyone. Sometimes a new therapist comes in and they're just beginning to call, and you just so happen to call and be like, oh yes, we can start your appointment. So definitely call back and follow up if you're on a wait list. So once you call and you are considering speech therapy. So, what to consider when choosing a speech language pathologist or a speech center or therapy? There are different factors for you to look into: experience and their specialty area. It is crucial to make sure that the therapist that you're looking or seeking or communicating with has their license, their state license. That's number one. I don't know too many therapists who practice without a license, but I'm sure there are people out there who are doing it. And so you can go on the Georgia board, and I believe in the other states I lived in, you can go and search to see if that uh, practitioner or therapist has their license and that it's active. So look at the experience. Are have they just started? Their specialty area. Speech therapy is such a broad field, and no one therapist is great at everything. And so, if your child has stuttering needs, you might want to go find a therapist who specializes in stuttering. For instance, my strong suit is not stuttering, and so I always refer my patients out to another therapist who specializes in dysfluency and fluency disorders. Um, Check their availability. Is it a wait list? Is the wait list a year, or is it 2 months? Do they have people moving and you'll be able to start in a month? And also look into the location. Sometimes parents will call and call. I had a parent call me from an hour away, and so distance. Will you be able to come an hour in Georgia on 75 twice a week on time, uh, and meet your therapy session needs? Consider your insurance. Some insurance providers only offer a certain amount of therapy sessions. It could be 10, it could be 20, it could be 60. You would have to determine that. You and your provider will have to determine that. Will there be out of pocket costs? There's some sessions, some providers, insurance providers, where every session you come, if you're coming twice a week, you will have to pay $40 or $50 or $10, whatever your copay is. And so you have to consider those things as well. And the commitment. A lot of times, speech therapy, you're beginning at 6 months. Authorizations and plan of cares are 6 months to a year. So, are you going to be able to do that and have attendance and work on what the therapist gives you at home? And whether, and also, are you compatible with your therapist? This is someone who's going to be serving your child. You're going to be interacting with them. Do you all get along? Do you like how she approaches you? Do you like how she speaks to you and your child? So, or he, you will have to determine those things and consider all those things when you're choosing a therapist or center. So, what is therapy? Speech language therapy addresses developmental challenges, and that's what I see a lot in my office with younger kids: developmental delays, neurological conditions. Therapists work with patients who've had traumatic brain injuries or strokes, and other factors affecting communication. We enhance an individual's ability to express themselves, understand others, and navigate social interactions, and promote a better quality of life. That's the ultimate, for that our patients are able to um, go through life being heard and understood and conveying their thoughts and wants and needs appropriately and effectively. The purpose of speech therapy is communication improvement. That's the primary purpose, to increase communication. Language development. Speech therapy assists individuals in developing and improving their language skills. Speech improvement, increasing intelligibility, and increased confidence in social skills. And so, if you are confident, if you how you like how you sound, you speaking, your fluency, you understand, then that will help with your confidence and interacting with others on a daily basis. Therapy settings. Uh, there are various places where therapy can take place. Schools, that's one of the bigger areas where students receive services from preschool to high school, small groups. Most of the time, if you are receiving services in schools, you have an IEP or individualized education plan or a service plan, and it's usually connected with academic need. You can have I apologize. You can have students who have articulation errors, like R's or S, but a lot of times you will find if they are making progress academically, if they have good grades and it's not so affecting them socially, then they will not meet eligibility in the schools for that service. Medical settings, you would need a medical need. And there are times when insurance companies will deny and say, oh, that is, the school should address that. That's an academic need and not a medical need. So that's one setting, the medical setting, hospitals, doctors' offices, outpatient rehabs, nursing homes, hospice, hospitals or centers are usually medical settings. We see speech therapists, therapy centers like private practices, rehabilitation centers where you have occupational therapists and physical therapists, music therapists, and different therapy centers. You will find a speech therapist, and in the home, speech therapists serve families in the homes. A lot of early intervention, babies can't wait, will serve in the home in the child's natural environment. um, they serve school age kids in the home through telepractice or telehealth, elderly care, elderly care. We have patients with aphasia or strokes, and they're at home, and so therapists will go into the home to serve those patients. And types of therapy, primarily perform play based therapy. I have little ones, so we're often on the floor. We're playing. I'm following the child's lead, what they want to play with. I'm providing them the language that they need, introducing new ways of communication, whether it's with a device or a sign. And so, what I do with my young kids is play based. There's also formal therapy, especially with older kids in school setting. The kids are sitting, you're using cards, you're drilling, you're using worksheets. You're also more structured, and this is for older children and adults when they're receiving their services. There's group therapy. You'll find that a lot in school settings, social groups, autistic groups where they're learning to interact with others, learning pragmatic cues for language and communication. These groups, they can have similar goals or they could have various goals, and they're working together in the group. And you can find group therapy for children and adults. Teletherapy is online, and this has been around, but it really gained some interest when COVID was rampant and we had to shut everything down. Teletherapy or telehealth is online. You're using your computer, the therapist is on one end, and so there are different ways to work it where you can give control to the computer and the child can use it, adults and children. I do know of therapists who see even younger 2 year olds and 1 year old, and a lot of time that's geared towards parent training on what they can do at home with their child. I think I went ahead. Types of therapy, we did that. And so, in summary, SLPs are highly trained healthcare professionals who specialize in um, evaluating, diagnosing, and treating communication and swallowing disorders. We collaborate educators, caretakers, and community members When searching for an SLP, consider experience, specialty, location, insurance, and commitment. You contact your speech therapist, speak to your pediatrician, request a referral, hearing screening, search for your local therapist. You could do that online or get referrals from family and friends. Call and follow up. Therapy. The purpose of therapy is to enhance an individual's ability to communicate effectively. Settings of school, medical, private practice, centers at home, different types of therapy, play, formal, group, or telehealth. And so, for some tips, if you are on a wait list, call back to follow up. Babies can't wait. Early intervention serves babies 0 to 3 years old. At age 3, many school districts will evaluate and serve 3-year-olds at no extra cost. So, I do refer my patients if with my wait list, I would tell them and say, your child is 3. Do you know you can call your local school district? I don't know how it is everywhere else, but here where we are, um, our local school district at 3 years old will evaluate a child for speech language therapy or other services. And you just have to call. You don't need a referral. You'll say, I have concerns about my child. I would like an evaluation. They'll send you the information. You'll fill it out. They schedule an appointment, and then they will serve. They will either go to your child's daycare or you could bring them to the school. So it all depends on your situation, but that is definitely an option. Babies can't wait here in Georgia or early intervention everywhere else. And they have different names, but the service is usually free 0 to 3 years old. And 3 years old, the school system will provide the services the child needs. This is jumping ahead. So thank you, and I hope you stay connected. I hope that this was beneficial and that you were able to get some information regarding what a speech language pathologist is and what is speech therapy, and what you can do if you're starting the process to look for a speech therapist. And uh, our next session will be discussing facilitating language at home and how you can increase language and have strategies to use at home without buying any new devices or anything like that while you wait, or even if you're not waiting, just to enhance language. Please like us and follow us. Share the video, share the information with others. We will definitely be doing more of these. And our next session will be facilitating language at home. Follow us so that you get the notifications when we are live or when we have posted our videos. We also will be on our website, and under the links for the video, we'll have a link for the speech language therapy uh, sheet where you can keep track of who you've called and who you've called back and whose wait list you're on. I have parents who call me and say, "Okay, I'm not sure which place is this." When I return their calls, so this will be a quick sheet for you to just be able to get the information that you need and keep it handy for your callbacks. So thank you again. Thank you again. I hope to see you for session 2. I'm Shirley Jackson. I'm the speech therapist at Shout Speech and Language Therapy. I'm located in Locust Grove, Georgia, and we are excited and looking forward to providing more of these sessions for you all, giving you information about speech language development and disorders and the process to when you're seeking services, and once you receive services, what your role as a parent is and your parental rights. We hope to see you again. I encourage you to definitely ask questions. You can comment. If you are local and looking for a speech therapist, you can give us a call. If I can't help you, I will find or direct you to where someone can help you or who does have opening for speech sessions. I hope you all enjoy your day, and I hope you will come back and join us for session 2. Have a good one. Thank you. Bye bye.